Hello, my name is Stacia.
I'm Bethany.
Our project is on exposure therapy for sexual assault survivors with PTSD. We wanted to change it up a little bit because normally people associate PTSD with war veterans.
The history of exposure therapy. Exposure therapy has been the leading technique for PTSD, like victims of PTSD, for over 25 years. It's been studied, like researched, and it's been proven to be the leading treatment and like therapy for people with PTSD. And it can be used like for various different kinds of PTSD. It doesn't matter, like veterans, like Stacia said, or sexual assault victims, or anything that has had like a traumatic event that they're over and over and over, like reliving their trauma or having flashbacks or anything like that.
Studies show that repeated exposure eventually will lessen the emotional activation or reaction to triggers, pretty much dulling down the emotion. The idea is that if you show images repeatedly to, say, a sexual assault victim of like something that triggered it, like a bed or something, it will decrease their reaction. With time, the patient should have more self-control and confidence and reacting more positively.
Prolonged exposure. We're going to show a little clip that kind of introduces prolonged exposure. So.
PE is a treatment that helps people face their fears. An analogy I like to use is a wound on the battlefield. The person's out there fighting on the battlefield and they get a deep cut in their arm. They wrap it up with the bandage in their hip pocket and they keep fighting. And after the battle, they go back to the base and they have this wound. It's a deep gaping wound with a field bandage on it. And there's a lot of dirt and a lot of grime in there that can get infected. A person has to decide what they want to do. Do they want to take the bandage off and clean it out? Or do they want to leave the bandage on and take their chances that it will heal on its own? Most of the time, they need to take the bandage off and clean out the wound. And that's what exposure therapy is. It's basing that which can be a little painful and hurtful at the beginning. But it's a treatment that helps a person do that at their own pace. It's important that patients feel a sense of control as they face their fear. Because control is one of the things that's sometimes taken away by trauma, a sense of control. And so this treatment helps people face their fears at their own pace, and they get a sense of control over their life.
One of the things that I could initially tell you that something that can shock you with it is that it's going to involve not only talking about your trauma in a lot of detail, but taping that and listening to those tapes daily. And we're also going to involve doing some what we call in vivo. And really what in vivo means is in the environment. But really what that means is going out in the environment and doing things to re-practice and relearn that under different set of circumstances, that bus stop where you were raped, well, under different set of circumstances, it means it's just a bus stop. That trash on the side of the road, if you're a veteran and you had an IED blow up, well, in different set of circumstances, that trash is just trash. So we're actually having to have you experience some of those things again in this environment so that you can make the connection that there has been a change. And then your body actually starts to change its reaction. You don't get as anxious.
In summary, the purpose of this video is to show the importance of educating patients with PTSD so they know the long-term outcome of the therapy, which leads us to the 4 steps of exposure therapy.
It's important to educate any of your clients that you are going to be using exposure therapy on. They need to understand and know how, and that they are, like in the video that they talked about, that they are going to be reliving their trauma. It's not just going to be like we're going to kind of go around the topic, that they're going to have to actually go and talk about it. So it's important that they know and what's all going to be included in that therapy.
The second step, which these can be interchanged, but this is generally the order. The second step is breathing. To teach your patient about the importance of breathing so they learn how to control their anxiety, or they can calm themselves when they feel like they're going to be re-experiencing a traumatic event.
In vivo, as the video also talked about, it's taking an object that is, there's nothing wrong, it's like a safe object, there's nothing, but they connect it to something negative, like the trauma event like that, and showing them, like through homework assignments or through different things like that is just that. It's not, doesn't have to cause you to relive your memory and stuff like that. It just kind of becomes how to look like normal. It's just something that's there in that environment.
And the final step is imaginal. This is like imagery or hearing someone's voice or even like the in vivo is kind of like a homework assignment, but it goes along with imaginal. You can like record yourself and then re-listen to it so you experience that over and over and dull yourself down to the memory or the traumatic event.
And imaginal is also something that's like when you're in session that you're doing with the client and you're with them, making sure they're in a safe environment and that they feel safe and in control while you're going through that, so they're not like out in the open when they have an anxiety attack and stuff.
And this is our final slide. This represents what we're going to be leading into with the role play. A bed is, for our patients, for the purpose of role play, is their traumatic trigger. Like, they were all sexual assault victims, so this is their trigger. And that's the end of our lecture.
Any questions for the ladies about exposure therapy? So war veterans, sexual assault, traumas, what other populations would you suggest this would probably work for?
Another study was done on Eastern cultures, because this is more popular in Western culture like the United States, but they did it in Japan for like natural disaster victims, like tsunamis and earthquakes and stuff, and it works. It was proven to work the same. It was just as effective.
Great.
So that kind of population, natural disasters, stuff like that.
Mm-hmm.
I also found a study like kids can have PTSD too, like adolescents and stuff like that, so they said you could use exposure therapy.
So for different age populations and different kinds of traumatic events, whether it be natural disasters or more things that human beings had, like war or sexual assault or abuse kind of victims as well. So it's kind of, it works, it sounds like, for a broad spectrum of
Right.
populations and ages of those different
And it's very
populations.
effective.
In its height and its effectiveness. That's great. Any other questions, ladies, about the presentation? Okay. Good job.